Starting with some developing news, mass layoffs beginning for federal health and human service workers. We've been watching them packing up their offices at the federal building in San Francisco. The department says it plans to lay off 20,000 people nationwide, and it has begun. Veronica Macias live for us in the city. Veronica, what are you hearing from people?
Lots of sadness here and this morning. Earlier, we were able to talk with a regional program manager here at Health and Human Services Region 9 office, and she tells me everyone, the 65 people within her division that have been let go today, just an overnight notice, they are devastated and heartbroken. A lot of people making careers here at HHS over the years. And earlier, we also spoke with other people who simply are in shock of the news. Now, we know that this email came overnight and it was very brief. It didn't say much. It just basically thanked people for their service. And while people tell me that the writing had been on the wall, and this comes really at no surprise to them, they're really describing these layoffs as chaos and really a blow to public health services. This morning, employees again received that letter of termination, and many of the people we talked to say they've made careers here. Imagine working somewhere for 25 years and then being let go because the administration, they say, believes that your job is useless. Workers say last week they received news that 5 out of the 10 offices were going to be scrapped completely, but there was no indication what offices. And while the administration is aiming to cut some 10,000 jobs to streamline work, these cuts, according to workers let go today, will soon impact the greater public.
These are the services that serve the taxpayer, and they are gone. The people who administer these programs are gone. So I don't think the regular taxpayer understands how government works and how these services actually serve them until they don't get their Social Security payment, they don't get their SNAP, they don't get their welfare check.
Meanwhile, Secretary of Health and Human Services Robert F. Kennedy Jr. in a statement saying, "We are realigning the organization with its core mission and our new priorities in reversing the chronic disease epidemic." As for the workers that we talked to that are being let go today, they tell us, for the remainder of the day, they're going to take a deep breath. But already, and some of them are looking to appeal this decision and seeing what legal action they can take. As for former Secretary of the House here in California, Nancy Pelosi, of course, this being a building dedicated to her, she also released a statement already slamming this short-sighted decision, she says.
All right, and we have that statement coming up. But yeah, Veronica, boy, sending all the good vibes to those people trying to figure out what they're going to do next. Appreciate your live report. As we said, San Francisco Congresswoman Nancy Pelosi responding to the potential closure. Here is part of her statement saying, "Make no mistake, the reported plans to restructure HHS and close the San Francisco regional office would directly harm our most vulnerable communities and make America sicker. In coordination with my colleagues in Congress, I am examining all possible avenues to fight back against these irresponsible cuts."